Hi viewers, I am Dr. Surendran, Consultant Senior Oncologist, LK Hospitals. Malignancy or cancer was once thought to be a very dangerous, dreadful disease, but now it is no longer so. That's because of the understanding and knowledge of cancer that has led to the present adequate state of management for malignancy. I belong to a specialty of cancer management, radiation oncology, which is one of the very important and crucial among the three modalities of treatment available for cancer management. First and foremost is surgical management of malignancy. The second very important thing is medical oncologist's approach, and the third very important component is the radiation oncology management. As such, malignancy has in any site in the body, I can divide it into say 5 parts, where primarily it can occur in the brain, or primarily it can occur in the head and neck region, and it can occur in the thoracic region where breast cancer, esophageal cancer and lung cancers are very important cancers to be dealt with. The other aspect is the abdominal cancers, rectal cancers, liver malignancies, and next is the pelvic group of cancers, which can be a prostate cancer in the male, cervix cancer, endometrial cancer, ovarian cancer in the female, rectal cancer and bladder cancers. All these type of malignancy have to be dealt with in 3 important sequential ways. The first and foremost is the symptomatology. How we analyze, listen to the patient. Listening is very important component and aspect of management of malignancy. So listen to the patient symptomatology and find out and localize where the particular disease is. The next aspect is radiological investment, to make sure that this malignancy which you suspect, which can be in the throat, which can be in the lung, which can be in the prostate, which can be in the cervix, or which can be in the brain. Once we, by the symptomatology, understand that this malignancy is in that part, we do radiological investigations pertaining to that point to fix up our diagnosis professionally. Once we find that there is some abnormality in this organ which is displayed on the scans, the next third component, which is again a very crucial component, which is done to fix up the diagnosis of malignancy, is pathology. We go in to obtain some tissue from the site of the cancer and analyze it under the microscope by pathological means to fix it up. Once the malignancy is diagnosed, then the treatment part starts. So as such, cancer management is of very important aspects of cancer management is 3. One is teamwork. Teamwork means what I already mentioned: the surgeons, the medical oncologist, the surgical oncologist, the radiologist and the pathologist. So all these is first of all joined together to form a teamwork to fix up the diagnosis. Next comes the treatment part. In this part, some more people get into the teamwork. So we form a framework where a surgeon has to go to the theatre, and when the theatre is involved, we need an anesthetist there to manage the patient, and then the patient comes after the treatment. For example, if a breast cancer is operated first, the breast is removed, the cancer is diagnosed. Then for some reasons, to prevent the spread of the disease, which are scientific, they have to undergo a process of chemotherapy followed by radiotherapy. So again they have to come to the radiation department, where again a framework of or a workflow starts, which means there is a medical physicist involved, a radiation technologist involved, and a big infrastructure by a very modern linear accelerator radiation therapy management is done. And then the patient goes, if the patient has the risk of metastasis to other sites, to the medical oncologist. And this medical oncologist is very, very important to prevent the disease or prevent the recurrence of the disease as and when needed, and they apply chemotherapy. This chemotherapy has evolved over times to very modern type of chemotherapy, and they are very, very crucial, particularly in the management of breast cancer, lung cancer, and some of the head and neck cancers, and more of the pelvic group of cancers. So for all these things, teamwork, network, and framework, we need adequate digital communication and digitalization of all the paperworks is very important. And finally, the coordination among us, the information and communication that has to be passed on between us, so that at every point of time we deliver actually what is needed to the patient. And the last but not the least, our relationship with the patient is very, very important. This relationship is very crucial because the patient gets into a bondage or a kind of commitment, we and the patient. It is a very delicate and divine kind of relationship, which is our responsibility to get the patient out of all his problems, not just the physical problem, his mind, his spirit, and this treatment lasts for several months, and we have to follow up these patients for several years. So this is the bondage which we have with the patient. We must gain the confidence of the patient that we are committed to them. For this, our hospital has got at all levels the resources, infrastructure, and the technology to deal with all kinds of cancer patients. One last word before I finish. The earlier the diagnosis, the more assured the cure. Thank you.